Good afternoon, everyone. I am Stacy Olds, class of 2004, and president of the San Antonio Alumni Chapter. On behalf of the San Antonio Alumni Chapter and the National Alumni Board, it is my pleasure to welcome you to our luncheon honoring the 2013-2014 Trinity University Outstanding Young Alumna. Today, we proudly recognize one of our 26,000 alumni, Ms. Alyson Rosewood, class of 2003. Currently, she is an international public health specialist in the Office of Global Affairs at the Department of Health and Human Services, who has worked tirelessly helping Trinity establish summer internships for undergraduate students in Washington, D.C. She has offered considerable assistance in establishing a Trinity presence in global health. Today, Alyson Rosewood is the 11th graduate of Trinity to receive the prestigious Outstanding Young Alumna Award. This award was established to honor Trinity alumni who have graduated in the past 15 years. We select alumni who have distinguished themselves in their profession and in service to the community, setting a standard of excellence worthy of recognition by the Alumni Association and the university. We are especially proud to be able to claim Ms. Rosewood as an alumna of this institution. You will hear more about her impressive work during our lunch. At this time, I would like to ask Reverend Stephen Nickel, Trinity's chaplain, to give the invocation, followed by lunch, and then a return to our program.
Let us unite our hearts in prayer. Merciful God, you plant within us a seed of bold hope, which blossoms and bears the fruit of empathy, of passionate creativity, of diligence, as you transform us into agents of your grace and stewards of the beauty of your creation. We celebrate that transformation today, Lord. We celebrate the passion and excellence and renewing vision of your servant Alyson, one of Trinity's own. We lift up thanks for her and the path she has journeyed thus far. May her example be for us all a challenge and an inspiration to cultivate the bold hope planted within each of us, that the particular enthusiasm that claims us might bear good, wholesome fruit through which the world's hunger might be fed. By your grace, may it be so. Now bless this food and our table fellowship, we pray. Amen.
Hello, everyone. Hope you're enjoying your lunch. Please feel free to continue to finish your entrees and to dive into your desserts and your coffee. But we are going to go ahead and continue the program at this time. So again, we are very pleased that you have joined us to recognize Trinity's outstanding young alumna, and we are pleased to see so many students. So thank you, students, for being in attendance. We hope that you will be inspired by Alyson's work and accomplishments as you become Trinity alumni and do amazing things yourselves. Before we begin the program, I'd like to take a moment to recognize the special guest with us at the head table, Trinity's president, Dr. Dennis A. Albergue, our honoree, Alyson Rosewood, and her husband, Peter Hubbard, her father, Peter Wood, close family friend, Sally Kane, Peter Toby Merkt, Alyson's official mentee and former employee and a model global health alumnus of Trinity, Reverend Stephen Nickel and his wife, Catherine Morell Nickel, and Dr. Robert Blystone, Professor of Biology. And now it is my privilege to introduce the president of Trinity University. Dr. Albergue became the 18th president of Trinity University in 2010. A native of Australia, he received his bachelor's in economics with first-class honors from the University of Sydney, a master's in economics from the Australian National University, and a PhD in economics from the University of Pennsylvania. Dr. Albergue's journey to Trinity includes a distinguished record of research and teaching and an impressive career as a transformational academic administrator. He is married to Penelope Harley, an attorney specializing in alternative dispute resolution and restorative justice, and they are parents to 7-year-old Benjamin. Please welcome President Dennis Albergue.
Thanks, Stacy, and good afternoon to everybody. As you know, the Alumni Association has a couple of awards for alumni. And for the students, it's been explained to me that this afternoon's award ceremony is distinctive because the aim of the event is to show you that you don't have to be old and have gray hair to have done great things. So that's what you need to take away from this afternoon's event. We're really here to hear about Alyson's time at Trinity and then her life and her very, very successful career path after graduation and before she becomes old and gets gray hair. So that's what today is about. And the person that will introduce her is Dr. Robert Blystone. And Dr. Blystone began his tenure at Trinity as an assistant professor of biology in January of 1971. He was promoted to professor in 1984. And Dr. Blystone, as you very well know, has done many, many things at Trinity, and in fact, he has done most of them twice. He served as the chair of the biology department twice. He was elected vice chair of the faculty senate twice, and chair of the faculty senate, again twice. He's also served briefly as acting associate vice president for academic affairs, but only once. I assume he didn't like that the first time and left it at that. Dr. Blystone currently teaches microanatomy, developmental biology, and the first year seminar, and he also supervises the teaching of anatomy in Spanish. He's also team teaching a course entitled Introduction to Global Health. He has been named a Piper Professor for the state of Texas for his distinguished advising and teaching, and indeed has won Trinity University's highest honor, the Z.T. Scott Award, again for outstanding contributions in teaching and service. So it's my pleasure to welcome Dr. Robert Blystone.
Good afternoon. I am old and I am gray, and it's my honor to introduce someone who isn't old and isn't gray. On Friday, January 20th, 1961, John Fitzgerald Kennedy stated in his inaugural address as the 35th President of the United States, "And so, my fellow Americans, ask not what your country can do for you, ask what you can do for your country." Dr. Cheryl Tynes received a letter dated December 15th, 2009, from two Trinity alums, Alyson Rosewood, class of 2003, and Reed Holman, class of 2006, They began their letter to the Associate Vice President by stating, "We are writing you as two graduates of Trinity University who now find themselves working in the field of global health within the U.S. Department of Health and Human Services in Washington, D.C. This letter's purpose is to urge Trinity to consider building global health into the university curriculum for the reasons outlined below. To ensure clarity, we define global health as an area of study, research, and practice that places a priority on proving health and achieving equity in health for people in our country and in all countries worldwide. The most immediate outcome of Alyson and Reed's letter was a teleconference held between these two remarkable alums and a group of Trinity faculty and staff on February the 5th, 2010. The first course in global health at Trinity has its roots in this meeting. A curricular initiative culminating in a minor to be in global health began. A campus-wide symposium on global health was seeded, and a wonderful array of Trinity students have been placed in various global health internships in the Washington, D.C. area, including Nicole McCauley, Jake Reynolds, Nyasha Gandor, Peter Merkt, Christina Olson, Abby Lohr, Allison Kimura, Allison Krause, Shannon Baldwin, Faith Ozer, Evelyn Murillo, Sarah Scott, and Aparna Gomez. All these good deeds, based on a simple, direct, honest appeal by two alums wishing the best for their alma mater and its students. Alyson and Reed were moved by what they could do for their university. I never knew Alyson Rosewood during her undergraduate tenure at Trinity. But through our interactions over the last 4 years, I have come to believe that the street that terminates at the Chapman Fountain was either named after Alyson or she took her name from Rosewood Street. As a microscopist, I have been able to analyze her accomplishments most carefully, which led me to nominate her for this recognition that brings us together today. As I look at the many Trinity students in this audience, the undergraduate career of our honoree deserves special attention. As Alyson arrived as a Trinity first year in 1999, she had received the Gold Award from the Girl Scouts of America, their highest award. Even today, Alyson is an assistant leader of Brownie Troop number 78 in Washington, D.C. While at Trinity, she was recognized as the Nikon College Photographer of the Year, 2001. In 2012, Ms. Rosewood traded her Nikon for a space camera and published a paper on mapping malaria with satellite imagery. Alyson spent her undergraduate summers as a whitewater raft guide in Moab, Utah, and as the head guide in 2003. She followed her U.S. rafting exploits by becoming a whitewater raft guide trainer for the Ethiopian Ministry of Tourism, Omo River, Ethiopia. Her husband, Peter Hubbard, is a former whitewater raft guide. To the students here, what you do now at Trinity often reappears in a grander form in your later life. Alyson Rosewood's academic birth date is May 2003, with a BA in English Literature and Political Science. She graduated cum laude and Phi Beta Kappa. She received in 2009 an MS in Global Health with a concentration in Infectious Disease Epidemiology from Harvard School of Public Health. 2 years later, Ms. Rosewood completed a certificate in legislative studies from Georgetown University, and last year, Ms. Rosewood became a lieutenant in the United States Public Health Service Commission Corps. As her 2-year service in the Peace Corps came to an end in 2006, Alyson was presented the key to the city of Tilagrit in Morocco, where she had been a community hygiene and sanitation educator. She built a gravity-fed water system for 3 villages. She organized technical training of traditional birth attendants and developed childhood nutrition programs. She wrote a guidebook in French, Arabic, and English to all the water resources for that region. She served as a Berber translator for English-speaking doctors working on Operation Smiles. Just 3 years after graduation from Trinity, she was hiking over the Atlas Mountains, delivering health education information and supplies to 6 remote communities in that area. With this Peace Corps prelude, Miss Rosewood really gets rolling. As the Special Assistant to the Center for Faith-Based and Community Initiatives, Office of the HHS Secretary, then as intern for the President's Malaria Initiative, Bureau of Global Health USAID program, and then as researcher for Epidemiology GIS Unit, Malarial Research and Training Center in Mali. Returning to Washington, Alyson became a Presidential Management Fellow for the National Cancer Institute, and then continued in that role for the Office of Global Affairs, and then continued in that role for the National Eye Institute. These position titles are wonderful, but the devil, as they say, is in the details. Establishing healthier male gender norms, a document prepared for PEPFAR. The 2008 Malarial Operational Plan for Zambia. Participation in the UNICEF distribution of millions of malarial bed nets. Working with the Malian Ministry of Health on under 5 child morbidity. Working on spatial analysis and mapping tools with cancer registry data to analyze cancer trends in the United States, and even the on-ground presidential representative in Port-au-Prince during the early stages of the Haitian cholera epidemic. These are some of the details. Currently, Ms. Rosewood has found a 3-year home in the Office of the Americas, Office for Global Affairs, HHS, as an international public health specialist. Her job functions and responsibilities read like the index of a textbook on global health. I should know, because I've been reading indices of these books, trying to find the right one for a global health course at Trinity. On several occasions, Alyson has Skyped into our global health classes and even appeared in person in these courses. Reaching back to John Kennedy's inaugural address from 52 years ago, to those peoples in the huts and villages across the globe, struggling to break the bonds of mass misery, we pledge our best efforts to help them help themselves, for whatever period is required, not because the communists may be doing it, not because we seek their votes, but because it is right. If a free society cannot help the many who are poor, it cannot save the few who are rich. Lieutenant Alyson Rosewood is an exemplar of someone who has helped the many who are poor. She has not asked what her university can do for her, but rather what she can do for her university, for her country, and for her fellow humans. It is my pleasure and honor to introduce you to Miss Alyson Rosewood, class of 2003.
So, Alyson, it is my honor on behalf of Trinity University and the Trinity University Alumni Association to present you with the Outstanding Young Alumna Award. And if many of you are feeling like you're an underachiever, I know exactly how you feel. I'm exhausted, and that's only the first 10 years. Great, congratulations. Perhaps Peter can hold a second.
Thank you.
And for those of you without X-ray vision, let me read the certificate. For the empathy, care, and commitment she has exhibited throughout her career, for her leadership, accomplishments, and sustainable impact she has made on health services worldwide, for creating initiatives designed to help faith-based and neighborhood organizations fight childhood obesity and hunger, for providing guidance on health problems, programs, initiatives, and policies in 37 countries in the Western Hemisphere, for actively and aggressively assisting Trinity students with global health internships and working towards establishing an undergraduate global/public health curriculum, and for the honor and distinction she brings to her alma mater. Congratulations.
Wow, that's quite an introduction to follow. My mother likes to repeat to me and anyone often that we should live for our eulogies and not our resumes. But hearing my resume read explained is thank you. Thank you for the introduction, Bob, and thank you for your continued support of me and other students, current and former, who are interested in pursuing public health. Well, good afternoon, everyone. President Albergue, distinguished faculty and staff, fellow alumni, current students, sorority sisters, family, and friends. And please note that these categories are not mutually exclusive. I should also mention that in looking around the room, I see two former bosses of mine, Jacob Tingle included, who was my boss at Outdoor Recreation. I see one former intern, as mentioned, Toby. Advisors, both academic and life, one pen pal from my time in Morocco, and one of my first friends at Trinity, and a handful of Trinity alumni who I've been in touch with about their own interests in public health, and who are people who inspire me every day. You know who you are. I want to begin by thanking Professor Blystone, Reverend Nickel, and Stacy Olds for the words that you've shared with us today. I'd also like to recognize the entire Alumni Relations Office, including Christine Martinez, who orchestrated today's event. When Mary Kay Cooper, director of the Alumni Relations Office, called me to let me know I'd won this award, or I was going to receive this award earlier this year, I responded in the unfortunate way we all do when our cell phones have no more juice in them. I hung up on her. So she only had enough time to convey the news, and I didn't even, I think, have a chance to respond, if anything, and the phone died. So I'm honored to have this opportunity to share a few words with you today that I didn't get to share with her on that phone call. Thoughts I have on Trinity, public health, and also the importance of connections. And in keeping to my English major roots, I thought I'd paint a metaphor throughout my remarks, so please bear with me. So since coming to my 10-year Trinity alumni reunion last month, I've been reflecting on the phrase full circle, which seems relevant in so many ways today. Most obvious, of course, is the formidable circle in the number 10, my 10-year reunion. It's also just to share not only my 10-year anniversary of graduating from Trinity, but I calculated these numbers. It's the 15th year of the Alpha Chi sorority I was a part of, and I mention them because they are here at the table today, and they blessed me by letting me be their president for 1 year, in which I ran meetings with a drum because I had found out that we had 3 percussionists in the sorority. So thank you. It is also the 27th year, I believe, of the Trinity Outdoor Rec program that I had guided for, and they let me go loose leading a whitewater rafting trip down the Lower Grand Canyon one spring break when I was here. That changed my life. And it's the 95th year of the Trinitonian newspaper, which I photographed for. Today's award ceremony also highlights the personal meaning for me of coming full circle. When I was a senior at Trinity, I was invited by the political science department to join their table at the luncheon for the first ever recipient of the Trinity Young Alumni Award. Just mentioning that because a lot of you were in that situation. Her name was Angie Bryan. And in her remarks, Angie spoke about being a career diplomat for the U.S. Department of State. She had served, if I recall correctly, in Pakistan and several other challenging posts, and reflected on her time that day. Like Angie, both of my parents were career diplomats, so I related to a lot of what she shared. But I also left the luncheon confused about my own career direction. Many friends that I would also follow in my parents' footsteps and Angie's and pursue a diplomatic career. At the time, as has been mentioned, I was an English literature and political science double major and was considering going into photojournalism. I had also just spoken, I think that very week, with Dr. Peter Balbert in the English department, and he had let me know I had a career in literary criticism if I wanted to pursue that. And I was also entering my 4th season as a whitewater raft guide on the Colorado River out of Moab, Utah, and I couldn't imagine a life without the river, even if it meant living in a car for the rest of my life. Yet here I am, 11 years later, speaking to a lot of current students at this luncheon, having entered my 9th year as a public health professional and as an active duty officer with the U.S. Public Health Service, which I should mention because many haven't heard of the U.S. Public Health Service. It's one of 7 uniformed services that serve this country, are active duty, but only 5 are armed, and those are the ones that most folks have heard of. And then there are 2 that you haven't heard of, and it's the U.S. Public Health Service, serves the Surgeon General of the United States, is within the U.S. Department of Health and Human Services, and it's our mission to protect, promote, and preserve the health and safety of this nation. So we have day jobs, and then we have to be ready to deploy to provide health response to disasters like Hurricane Sandy or international health response, such as the hurricane in Haiti, if our skill set is needed. And the other unarmed uniformed service, just to share, is NOAA, the National Oceanic and Atmospheric Administration, the weather people. And they wear the Coast Guard uniform. In the Public Health Service, we wear the Navy uniform. Though, as we like to remind the Navy on occasion, we had the khakis first. So my path to becoming a public health professional began with my becoming a Peace Corps volunteer, as my parents and many fellow Trinity graduates did before me. This is another circle. In Morocco, I served as a water sanitation volunteer working on addressing 2 of the most basic health challenges we as humans face: access to potable water and access to a toilet. It was also in Morocco where I came down with malaria and became very sick, was actually found unconscious, but survived thanks to access to decent health care and medicine. It was in my hospital bed in Rabat, Morocco, that I decided I wanted to learn everything I could about mosquitoes and the human diseases that they transmit, and then work to prevent others from dying of them. So fast forward a few years, I find myself now in my 4th year working in the Global Health Policy Office of the Secretary of the U.S. Department of Health and Human Services, and I cover the Western Hemisphere, as has been mentioned, which includes, since we're the Global Health Wing, we don't cover the United States, but we cover everything else in the hemisphere, except I do have the lead on the U.S.-Mexico border, which rings particularly close, having gone to school here in San Antonio. I love my job. I love working with my passion, public health, the health of people and populations. Thanks to the process of globalization, there is no longer a clear distinction between domestic and international health. Public health is global health. One nation's health status and risks can affect not only its own prospects and those of its neighbors, but also those of the entire world. And if you'll permit me for a minute to comment on the public health mission, which is both timely and timeless, the problems that preoccupied us a century ago when it comes to health still preoccupy us today. Around the world, advances in knowledge about how to protect the public's health have doubled life expectancy. But in today's world, this progress is imperiled by 4 major threats that I thought I'd mention. One thread is that of old and new pandemics, from diabetes and obesity, which yes, we do call them pandemics, to avian flu and antibiotic resistance. The SARS outbreak of 2003, followed by the H1N1 influenza A pandemic, exemplify how quickly emerging infections can spread, costing lives and curtailing trade among our interdependent economies. The second threat is that of harmful physical and social environments. From discrimination, toxic physical and social conditions, and the choices we make all play a role in disease. A third threat includes poverty and humanitarian crisis. I recently read that there is an average of 700 disasters around the world each year, affecting millions of people. And as I speak, health efforts are underway in response to the devastating storm in the Philippines, including the deployment of many of my public health service fellow officers. And the fourth threat is on failing health systems. We need to continue to identify ways to prevent costly and life-threatening medical errors, determine which prevention programs and medical treatments deliver better care more efficiently, and ensure that access to affordable care is viewed universally as a human right and not as a privilege. The challenge in public health is that if we do things well, nothing happens. It is hard to sell that to the news people when you're trying to sell the need to remark on the joy of an illness not encountered. The un-news of vaccine coverage ensuring there is no measles outbreak is one example. If we had made progress against public health threats, it's partly because of another circle, the circle of knowledge and education. Scientific discoveries are taken up and replicated through education. They ripple out into the wider world through translation, both completing the circle and starting a new one, since on-the-ground experience feeds new research questions. In 2009, another circle was drawn, and Bob mentioned it. I just graduated from the Harvard School of Health and was beginning a presidential management fellowship in DC with the National Institutes of Health. And at an engagement party for a fellow Trinity alum, I met Reed Holman, a 2006 alum of Trinity as well. We struck up a conversation, and as it turned out, Reed and I were both working at the US Department of Health and Human Services, and we were both interested in giving back to Trinity. 6 months later, our conversation grew into the letter that Bob read the introduction of, and we had sent that to Dr. Cheryl Tynes, who's here today, urging Trinity to consider building the global health component into its curriculum. Bob didn't mention this that we wrote in the letter, but I think we mentioned two of the things that we mentioned Trinity is perfect for. One is how multidisciplinary public health is. You need your economists, you need your communication experts, because you could have the best research in the world, and if you can't communicate that, you've got nothing. There's a fabulous book that CDC just came out with called Making Data Talk, and it's divided into chapters on how to convey health data to policymakers, to the public, and to the press, and it's completely different. And for example, one of the main arguments is it might be best not to quote a single statistic and to instead just tell a story. So you need your communication majors. I wrote them all down. You need your sociology, anthropology, theology. As was mentioned, I worked in the faith-based office and gained an appreciation. At the time, it was the White House Office of Faith-Based and Neighborhood Partnerships out of the HHS Center for Faith-Based Partnerships, but because faith is so important to so many people, you have to work through the faith leaders if you're going to impact health. So you need theology. You need statistics, demography, ecology, engineering, ethics and philosophy, political science, psychology, and the list could go on. And so it's perfect for Trinity. The other bottom line that we conveyed is Trinity's proximity to the US-Mexico border and the Caribbean and Central and South America. As you guys are probably familiar, the US-Mexico border is defined as 62.5 miles or 100 kilometers on either side of the border. It's close to us, but it's unique. Folks on both sides of the border have more in common with each other than either the rest of the United States or Mexico. And a lot of the health issues are like developing country issues, basic access to basic health care, access to potable water, just access to water, and other health needs. And so we tried to convey that Trinity is just in a unique geographical position. You don't have to, as a student, travel internationally to work on global health issues. So thank you, everyone who bought into our letter. So thank you, Dr. Tynes, for reading the letter and connecting us with Dr. Fisher and Dr. Blystone and others who we spoke with. And as was mentioned today, I understand that very soon this week, or sometime pretty soon, is when Dr. Blystone and Dr. Lacote are going to present the Global Health minor to the Curriculum Council for consideration going forward. So it's really exciting. So to get back to my speech, sorry. Thanks to the relationships that began with that 2009 letter, I know that at least 12 Trinity students have come or will be coming shortly to Washington, D.C. to intern with the U.S. Department of Health and Human Services and gain an understanding about how health policy, how it is made, communicated, and implemented. And I thought it would be neat, as I close up my remarks, to ask those students who have come to D.C., I guess through me, because maybe all of you have come to D.C., but to intern, or if you're about to, because I know there's one of you in the audience, could you stand up just to get a sense of who's here today? Thank you, guys. And I also know that there are many in this room that have an interest in public health and could potentially benefit from this minor, and I'm happy to be a resource or connect you to other alums if you'd like. In closing, I want to mention that I found my home at Trinity and for the first time in my life lived in one place for 4 years here. And as it has been mentioned, one of the things that helped me decide to come to Trinity was the fact there was a Rosewood Avenue. As I told my parents at the time, that was about 10% when it was getting down to it. Because I had this dream of having an address of, the apartments on Rosewood Avenue. I just thought that'd be the coolest address to have an apartment there. But I'm glad I came to Trinity. The school offered broad opportunities for me to study things from costume design and medieval literature in Middle English to small group communication. As Alpha Chi sorority president, I discovered an incredible group of supportive women who continue to inspire me today. And as I mentioned before, Trinity gave me a good set of soft and hard skills that have been useful to me in every iteration of myself since I've entered the professional world. To the faculty, staff, students, and alumni who have made Trinity the preeminent institution it is today, I am profoundly grateful. Thank you for this honor. As I have told many of the Trinity students I have mentored, please keep paying it forward. As a proud alum and a freshly minted member of the National Alumni Board of Trinity, I look forward to drawing an even wider circle of connections and powerful ideas in support of a healthier and happier world. Thank you.
Once again, I'd like to thank you all for joining us today on this special occasion to recognize one of the Alumni Association's finest. We are proud to claim Ms. Alyson Rosewood as our own and to honor her today. I want to thank our National Alumni Board's Alumni Awards Committee. Trinity has a tremendous pool of talented alumni with qualifications to make them worthy of consideration for these awards. We thank all of those who took the time to submit nominations for this year, and we encourage everyone to continue to provide us with nominations in the coming years. I hope the students with us today will use the incredible opportunities that a Trinity education will afford you. No matter what college she attended, Alyson Rosewood was destined to do something important in her life. Yet a Trinity education prepared her for success like no other. Alyson, again, congratulations. On behalf of the National Alumni Board and Trinity University, I extend to all of you our best wishes for a happy and safe holiday season. This concludes our program today. Thank you for joining us.